This afternoon, we have two amazing speakers. Our first one is Dr. Leslie Waltke. She is a physical therapist with a clinical mastery in cancer rehabilitation and the founder of the Waltke Cancer Rehabilitation Academy. Dr. Waltke, welcome.
Hello, how are you, Sherry? And thank you for the
I'm
invitation to
doing
be here
well.
today.
Thank you.
And thank you to all of the people online today. So I'm going to have this conversation directed more towards our patient population. And I'm excited to talk about this because, as we know, this is a really under-addressed area of breast cancer care. So um, thank you for that invitation. Let me pop that up. There we go. Um, and first of all, I want to give a shout out to Delta Airlines. They have a partnership with the Breast Cancer Recovery Foundation. And in their videos and in their communications, they do talk about male breast cancer. And they do highlight their employees who have breast cancer, including the men that work for Delta. So matter of fact, picture was taken on Wednesday of
Oh,
them
wow.
sporting their stuff. So they all were very excited. So Pilot and two of their gate agents. It was fun. So shout out to Delta.
Wow. Yeah, one
Um,
of their survivors actually gave us his story.
yeah, fabulous. I love it. I love it. So what are we going to talk about today when we talk about physical therapy for people with breast cancer, symptom control? And so we're going to talk about really regaining full chest and shoulder comfort, normal mobility, and then strength in that chest and your arm after surgery and radiation. We're going to talk about minimizing the amount of fatigue you have, the amount of neuropathy and weakness you may be experiencing. How do we reduce your risk of developing lymphedema? And then talking about exercise as a tool for decreasing your risk of this cancer coming back, because that's why you did treatment in the first place. And then we'll talk about weightlifting because it is safe and effective, and a lot of people are nervous to go back to that. And there's absolutely, not only is it okay for you to do, it's actually good for you to do. And I want to throw right out at the top of the conversation that exercise is one of the best and leading evidence-based treatments for cancer-related fatigue. So yes, it feels kind of a little backwards, like, well, if I'm tired, am I really supposed to be exercising? Well, the answer is yes. So the weaker you are, the more tired you are, the more fatigued you feel, the more exercise becomes a critical component in what you do to eliminate that fatigue. We will talk about exercise prescriptions, but I'm going to start right off at the top by saying anyone diagnosed with cancer, male or female, regardless of the type of cancer, it is suggested that these people get at least 150 minutes per week of moderate exercise. So this is moderate for you based on your age, your gender, your fitness level. So your moderate is going to be very different than somebody else's moderate. So 150 minutes comes out to about 2.5 hours a week, which is a commitment. However, your life depends on this. I always say exercise like your life depends on it, because it does. And there are 10,080 minutes in a week. So we can certainly carve out 150 of them to save your life, to increase the risk of you having a long and healthy life. So it's really, really important. And do you have to hit the 150 every month? Absolutely not. Anything is better than nothing. So a 3-minute walk is better than a 0-minute walk. But again, the more you do, the better. Of that 150 minutes, we want to target about 4 to 6 days a week of some kind of aerobic exercise. How you get that, your heart and your lungs don't care. If you're a gym rat and you want to head to the gym and do your stair stepper or your treadmill or your stationary bike, or you want to walk around the block, or you like to rollerblade, or you like to play hockey, it doesn't matter. Something aerobic. 4 to 6 days a week. And then 2 days a week, we should be strengthening your arms, your chest, your core, and your legs. All right. And again, you can do that at the gym. You can do it at home. You can do step-ups on some stairs. You can do sit to stand from a chair. You can do push-ups against the wall. All of that is a fabulous exercise. And again, as I mentioned, these symptoms are so prevalent after breast cancer treatment that we want everyone that's had surgery, chemotherapy, or radiation to get involved with a physical therapist, because their job is to improve your quality of life get you back to normal, get you strong, get you healthy, because again, that does improve your quality of life. It has been shown to increase how long you live, how well you live, and it's actually shown to decrease the risk of cancer recurrence, and it improves your overall survival. So the healthier you are after cancer, the likelier are you to have a long and healthy life. And again, as I just mentioned, most of the side effects that the crap that people have to live with after cancer treatment or during cancer treatment is typically from the surgery, chemotherapy, and radiation. And that really is what physical therapy is focused on. So anybody that gets treated with chemo, surgery, or radiation should have physical therapy. And we do want it to start right at the beginning of treatment. So I know most of you guys are already done, but you can advocate for the people in your life, for the friends in your community, that once they're diagnosed with cancer, you tell them to talk to their surgeon, physician, or nurse about getting a physical therapist. All right. So, and again, it's a little odd to connect PT and cancer. However, because when you talk about cancer, you think surgery, chemo, radiation. But again, once you start talking about surgery, chemo, and radiation, these are the top things that come into conversation. So weakness, pain, and fatigue are the top 3 symptoms experienced by guys that go through breast cancer. All right. And then there's numbness and tingling and limited mobility and balance problems and walking problems. All of this stuff is pretty typical for people that are going through treatment. And this is physical therapy stuff. So this is why we want you to get a physical therapist so they can deal with this stuff while your physician and nurses really focus on treating the cancer. So again, it's well documented that we know that chronic pain can be a serious consequence of surviving cancer. And it's reported that in breast cancer survivors, as high as 40% of people that are done with treatment are still having pain, still having weakness, still living with crap that doesn't have to be there. And as we see more people being diagnosed, we have more people on this planet. Our population's getting bigger. Our population's getting older. Again, those are 2 risk factors for getting cancer, being alive and getting older. So we're going to see more people living with fatigue and pain and weakness and function loss. And we don't want that. So again, really advocating for you to stay strong and stay healthy. Again, because the studies are very clear that rehab and fitness throughout cancer treatment and in survivorship have been improved to better outcomes for morbidity. And that's like all the crap, like the pain, the weakness, all the morbid things that happen to you, and loss of function and inability to be who you are. And then mortality, that's like life. So we know that PT improves morbidity and mortality for guys with breast cancer. So on a simple slide, we know that cancer diagnosis leads to some type of cancer treatment, and then cancer treatment leads to this crappy side effect profile. From surgery specifically, we'll see pain in the chest and the underarm, perhaps pain in the arm, limited range of motion. We can see scarring, soft tissue tightness and restrictions, muscle weakness, all of a sudden limited function. We'll talk a little bit about cording. And even some swelling problems at your chest, in your underarm, and maybe even in your arm are not atypical after a breast surgery. From chemotherapy, our side effect profile includes fatigue, weakness, pain, issues with your heart. Some of the chemotherapy medications are very tough on the heart. Neuropathy is the fancy name for the numbness and tingling in your hands and feet that come with some of the chemotherapy medications. Weight gain and weight loss are also very common for people that go through chemotherapy. And neither one of those things are good. And then muscle loss, bone loss, and then loss of function. It's hard to be who you are with all of this stuff going on from chemotherapy. And then from a radiation perspective, we kind of split our side effects into the acute effects, which means what's happening right now while you're going through the radiation, and then the late effects, which is like, okay, what's going to happen to me months and years after I'm done with the radiation? Well, for people who've gone through radiation, you know that the biggest side effects during radiation are fatigue, the skin reaction in your chest wall, or wherever you're getting radiated, and then pain and loss of function are pretty typical. Now, for later down the road, and my apologies, this word fibrosis should be over to the right here a little bit. So down the road, like scar tissue, and I'll show you scar tissue in a second, radiation fibrosis is like slow setting cement. And you may have felt this. You're like, I feel great after surgery, but then all of a sudden 6 months later, you're like, well, just my chest, my skin feels tight. It feels firmer. My underarm, my whole arm doesn't move well. That is very, very common late effect as the tissues start to shrink a little bit and scar from the radiation. But again, that takes months down the road. So again, I just want to point out again that what is successful cancer care? Well, obviously, we want to eliminate the disease or stop its progression. However, that's not quite good enough anymore. Yes, we want to do that. Plus, we need to return people to their pre-diagnosis activity and comfort levels. And that is usually, even in really ugly disease, that is usually possible with physical therapy. So the benefits of physical therapy to patients and survivors, we've already mentioned they're going to live better. Quality of life goes up. Length of life goes up. Overall survival goes up. But we're certainly going to see less fatigue, less pain, less weakness, less functional loss. People's hearts are going to be stronger and healthier. Their lungs are going to be stronger and healthier. And we're going to help people either maintain or improve their body mass index or their BMI, because we know that people that have their BMI is too low, under the normal range, that's not healthy for people. And we also know that the people that have a BMI above normal, that also can increase risk of some diseases and some increased risk for breast cancer recurrence. So we want to bring that back down. And it certainly helps people recover much more quickly when treatment is concluded. All right, so let's look at cancer surgery for breast cancer in men. So here's just a shot of how the breast tissue literally lays right on top of this big muscle here. It's called the pectoralis major. All right. And then these green things are your lymphatics, and they usually have to go, surgeons will go in here to pluck out 1 or 2 of those lymph nodes, or sometimes more, depending on your case. And then here is a picture of a mastectomy, right? So what happens in mastectomy is some of the lymph nodes may come out, and breast tissue will come out, but they are also going to take, in most cases, will take some of the skin, and as well as the nipple and areola complex. So then what the surgeon needs to do then is take this top piece of skin and pull it down and take the bottom piece of skin and pull that up and then sew that closed, typically in a straight line. So right there, you're already looking at tight skin. I mean, you've lost a bunch. So the feelings of tightness that you have, especially if you raise your arm out to the side or over your head, are pretty common, and that's one of the reasons why. Another reason why is now we're looking at your chest wall from a side view. So normally you have skin, then you have spongy breast tissue, and then you have the pectoralis muscle, okay? Well, with mastectomy, that spongy tissue, breast tissue layer comes out, and now you have skin literally laying right on top of muscle. And it can stick. Right? Those 2 layers normally kind of move nice and smooth, but now you've got skin on muscle, and sometimes if they sit there, they can kind of stick and get stuck, and that can do 2 things. It can be uncomfortable, all right? And it also then can limit the ability to get your arm over your head or reach comfortably either up to the side, out to the side, or behind you. Here is what kind of scar tissue looks like under the microscope. All right. So normal connective tissue has nice, long, they're parallel. There's not a lot of thickening or curvature. They're not really stuck together at all. And then here is scar tissue. And this picture was taken under microscope at about 2 weeks after injury. So you can see scar tissue is kind of lumpy and clumpy, and it doesn't follow a nice parallel pattern, and it's all kind of clumped together and stuck. And its job is just to kind of close a wound, and it does that very, very well. However, if this scar tissue is limiting or sticking things together, it can cause discomfort, and it can cause limited range of motion and mobility in the surrounding body parts. So here is a chest wall, and this is about 30 seconds after the breast came out. So here is the skin. All right, this is the subcutaneous connective tissue and a little bit of normal body fat. And then here is your pectoralis major muscle, all right? Now, this is without scar tissue, because this literally just happened 30 seconds ago. Now, here is this same chest wall about a year later. Okay, this was actually taken in a female. Who is now going back a year later for breast reconstruction. But you can see now this white and yellow stuff, this is scar tissue, and you can see how it is kind of sticking this skin and subcutaneous tissue to the muscle underneath. Okay. Now, this is a normal physiological process that you can't change, I can't change, your physician can't change, and certainly any medication can't change. Okay. But I'm going to tell you that this person this is a lot of scar tissue, which is normal, but this person was moving, they were stretching, they were reaching, they were lifting weights. So this person has zero pain, completely normal mobility, full strength, and she was actually an athlete and a black belt in Taekwondo. So, but you can see that if you're not moving during this scar tissue maturation or the radiation fibrosis maturation, again, which can take months or up to a year and a half, if you're not moving during that phase, that scar tissue is going to stick a bunch of stuff together. So it's going to limit you and make it very uncomfortable to move. So that's why we want people to move and stretch for the first at least year to a year and a half after their surgery and or radiation is complete. Now, if you have been tight for years and you're like, oh, that's what I've got, you certainly can start stretching now, and it will improve for sure. So if you are struggling, I'm going to show you some stretches in a little bit, but if you are struggling with pain or limitation, whether it's been weeks, months, or years, it can still be improved. So please, again, talk to one of your physicians about getting you to physical therapy. All right. Here is a nice shot of what the muscles look like underneath all of your skin. So this is your pectoralis major muscle, which is that big flat one on your chest wall. So what's interesting about the pec is it attaches to a lot of different bones. It attaches to your clavicle. All right, attaches to your humerus or your arm bone, attaches to your sternum, which is your breastbone, and then it attaches to your lower ribs. So if that thing is tight or restricted, you can see that for your arm to get over your head and for your chest wall to move normally, this pec has to move normally. So if it doesn't move normally, or if it's kind of stuck or it's kind of tight, this is why that can be uncomfortable and problematic. All right. Okay, so this is what's underneath your skin and underneath your pec. So here's the pectoralis major that has been pulled away. All right. So underneath the skin, the muscle is our lymphatics, our veins, our arteries. And that's, people think of the armpit as just kind of this smelly, benign place, but there's a lot of stuff going on in there, including nerves and all of that stuff. So it's important not only just for comfort and function of your body, but it's also important for normal physiological healthy function of your veins, your arteries, your lymphatics, and your nerves. So we do want that space to be mobile, to be long, and it flows and moves properly. All right, so here is a right underarm. Here is a left underarm after a lymph node removal. And you can just see sometimes, you can just look in the mirror and see this tightness. All right. And then here is, this is, oh my God, why am I blanking on his name? Oh, this is Alex. All right. So here is Alex's mastectomy scar. All right. And you can tell he's had radiation. We'll talk about radiation in a bit, but this is typically what a post-mastectomy incision will look like. And he's probably maybe 10 weeks post-surgery. So there's still going to be some healing at his chest wall in that scar. Now, if you have had lymph node removal, you may have noticed some either cords or piano-like strings in your underarm or in your armpit. If you have noticed that, that's what we call cording. And again, this is something I would want you to talk to if you're still living with it and dealing with it, it can be very uncomfortable. It's not dangerous, but it can be uncomfortable and painful and limit your mobility. But again, I would encourage you to get to your physician, cancer nurse navigator, or cancer nurse and have them get you to physical therapy to make that go away. All right, so here are some of the typical stretches for somebody, male or female breast cancer, male or female lung cancer, or any kind of melanoma, any kind of surgery or radiation to the upper chest, or to the underarm area. These are fabulous stretches to kind of, again, lengthen that skin, as well as keep the layers loose so they don't stick. So here is overhead stretch with the cane. Just sliding your hands behind your, clasping your hands behind your head and bringing your elbows down and out to the side is going to give you a great stretch across the chest wall. And then even doing, bringing your arms out to the side. I'll show you some video of a second when we're done here. And then I'll show you this trunk rotation stretch. You actually rotate your knees to the opposite side of your surgery, and then slide your arm, your involved arm, your surgical side out to the side and up over your head. That's the best stretch you can do to, again, minimize the risk of that skin sticking or it getting really, really tight after surgery and radiation. But I will show you an actual video in just a bit. Oh, here it is. Okay. And this is David. So David's laying on his back. He had a left mastectomy. So his chest was pretty tight, but he's doing quite well here. So he's going to demonstrate this stretch for us. So he's a left mastectomy, so he's going to roll his knees to the right. And then he's going to have his palm up, elbow straight, and just slide that arm, keeping it flat on the table or the floor and taking it up overhead. So if you've had a mastectomy with or without radiation, I want you to try this. Hit the floor, hit your bed, again, roll your knees to the opposite side of your surgery. Then again, I'm going to run this one more time because it's probably one of the more important stretches I can teach you. Palm up, elbow straight, keep it flat on the floor or table and just bring it out. You're going to probably be surprised at how tight that feels. And you can compare one side to the other to see. And if it feels tight, you can just leave it hang out there for a little bit, 10 to 30 seconds, and maybe repeat that 5 to 10 times. It's a fantastic stretch. All right, so to decrease your risk of lymphedema, which is a swelling in the arm, which can happen after lymph node removal from the underarm, the first thing we want you to do is regain full mobility and strength. So full mobility of the skin, full length of the skin, and full strength at that shoulder, because what moves lymphatic fluid is movement of your arm, muscle contractions in your arm, increased heart rate, increased breathing rate. So what does that scream? That screams of exercise. So exercise moves lymphatic fluid. So we want to improve your lymphatic system and make it happier. We want to make sure that none of that skin is compressing those lymphatics like we saw in that previous picture. We want to make sure that you have normal strength, that you have normal range of motion, that you are using that arm normally, because that is the best thing to do to strengthen your lymphatic system and make sure that it doesn't get overly stressed by anything that you do. We want you to gain or maintain an ideal body weight. We know that people that gain weight after treatment, and most guys and most women do, that actually increases your risk of lymphedema. And then learning infection risk reduction. So normally you can go through life and never get an infection in your arm. But one of the things that lymph nodes do is protect you from infection. So if you have fewer lymph nodes, you may be at increased risk of getting an infection in that particular arm. And that can actually increase your risk of lymphedema. So it doesn't mean that you can't push, pull, lift, carry, play with nails, go, build something, go fishing, go hiking, go hunting. All that stuff is fine, all right? But if you do scrape, scratch, burn your skin some reason, again, on your affected side, we want you to just keep that clean and covered and keep an eye on it until it heals. If it doesn't look like it's healing well, or if it looks like it's getting red or irritated, then we want you to call your surgeon, and they would probably get you an antibiotic. Okay. And that's your action plan. If you see something, respond to it right away. And again, regular exercise, which is good for everything that we need you to be doing, is also helpful in reducing your risk of getting lymphedema. So the more people exercise, the more reduction they have in their lymphedema risk. Okay, so let's talk about the dreaded cancer-related fatigue. 90% of guys that have surgery and radiation and chemotherapy for breast cancer will report fatigue. It is literally just that prevalent. And for many guys, once the treatment's over, the fatigue is still problematic. It can last for months, or even sometimes years. And again, fatigue is one of the most distressing side effects reported by people. And so it being both the most common and the most distressing, it is a big side effect that we really need to address. And again, we don't fully understand the reason of what really causes fatigue from chemotherapy, so we're not fully sure what the quote unquote etiology is. But certainly things that are going to contribute to your tiredness level is certainly if you're anemic, if you're in pain, if you're in distress, if your sleep is screwed up, if your nutrition is screwed up, if your activity is screwed up, or if you have thyroid issues or you have heart issues or infections. That's all obviously all going to contribute to your fatigue level. However, if we fixed all of that, people are still going to have cancer-related fatigue. It's just that different. But as I mentioned way up on top, exercise has been shown to be probably the leading and best treatment for cancer-related fatigue. All right. So again, this is moderate exercise, which is for you where you are right now, not how healthy you were 10 years ago or 5 years ago or last year. Moderate for you on that particular day, not moderate for your neighbor, not moderate for your brother. This is you. And we want you to target 150 minutes per week. Again, that's about 20 to 30 minutes a day, 4 to 5 days a week with aerobic exercise. And then again, twice a week, you should be strengthening your arms and your legs and your core. And again, this is lifelong. Every human on the planet should be exercising at these levels. But for cancer survivors, it's exceptionally more important to get this done because of all the things it can protect you against going forward. All right, now let's take a look at radiation. So here is a linear accelerator. So patient lays on the table and radiation comes out and into the chest. So you may have noticed, for those of you that had radiation, you probably had multiple fields. So you lay there, arms are typically over your head. This arm would be over your head as well. And they'll target the tumor area. They'll shoot a beam through one angle because they want to hit the skin. They want to hit the area where the tumor was. But they don't obviously want to hit your arms. They don't want to hit your bones. They don't want to hit your esophagus or your ribs or your heart or your lungs. So that's why they'll take that machine, hit you in one direction. They'll rotate the machine and then hit you in an additional angle. All right. And I guess then we mentioned during radiation, side effects typically include fatigue, the pain in the skin in the area where you're actually getting radiated, and then sometimes that can cause limited function. Right. Down the road, again, when that stuff starts to get tight, you can have permanent darkening of the skin, regardless of what your original skin color is. But you might, again, have restrictions in the skin, restrictions in the connective tissue, even the muscle itself can get tight, and have some immobility, discomfort, even some numbness. And again, if you have a super tight chest wall, that may increase your risk of getting lymphedema. So that's why we really want to work, again, with a PT and with a lot of stretching to make sure that your skin and your connective tissue move well around that area so this stuff stops bothering you. So this is Mr. Riley. He just finished his last dose. They got him pretty good, as you can see. He's also got his chemotherapy port here. But he's doing well, and his arm moved fully over his head. He can get it all the way over his head, but you can see now as this begins to heal, that we don't want this to get so tight that he can't move this left arm and this skin doesn't move well over his chest. And so you can see here, as I mentioned, he's got full range of motion. The arm moves completely fully. But again, we want to make sure as this heals that skin mobility and that skin length is maintained. So a year or two down the road, he doesn't have any trouble with this. All right. And then here's, a lot of times you can't see radiation fibrosis, but this is Bill. This is Bill's right axilla underarm, and this is Bill's left underarm after some really aggressive radiation to his armpit. And you can just see it's kind of thick and kind of leathery and tight. The skin, the blood supply is really trying to work on getting its way in there. So a physical therapist can't fix that fibrosis, but we certainly can, and certainly can lengthen it, soften it, improve it so it hurts less, so it moves better. So we were able to normalize Bill's range of motion, get his arms back to 100% strength again, and took away his pain and took away his limitations. All right. And again, this is the same treatment plan for chemotherapy, post-surgery, and survivorship. And again, it's at 150 per minute week target of exercise. And that fibrosis, like scar tissue, doesn't happen week one. It takes time. That slow setting cement concept I talked about. So it can happen over anywhere from a year to a year and a half. And in some people, it can be 3 years. So what we want you to do is just keep stretching for the first year or two after treatment. If you don't feel very tight and your mobility is normal and you can do that trunk rotation without feeling a lot of tightness, you maybe just check it once a month or once every other week just to make sure things are staying good. If you feel tight, so the tighter you are, the more often you should stretch. The less tight you are, the less you need to stretch. But certainly keep your eye on your chest wall because, a year after your treatment's done, you're like, I'm out of this, I'm done. And all of a sudden you're like, dang, this just feels really tight. And this is why. All right, now let's talk about chemotherapy. All right. So if you put 100 guys in a room that have had chemo, surgery, and radiation, most of them are going to say of the three, chemo was the worst. Not everybody, but most of them will. And that's because it carries the biggest side effect pile. All right. So fatigue, bone loss, muscle loss, numbness and tingling. It's hard on your heart and your lungs. It can cause weight gain. It can cause weight loss. It can make you nauseous. It can screw up your sleep. It can keep you from going to work. It can cause anxiety, depression. It just has a long list of just really yucky stuff. However, guess what? That exercise plan, so all of the patients in my health system, cancer center, regardless of their gender, regardless of their age, regardless of their type of cancer, get put on an exercise program during their chemotherapy and then certainly after. And again, what your program looks like is again based on what's available to you, your age, what kind of fitness level you're in. Some people, chemotherapy isn't too tough on them and they can do quite a bit of exercise, and other people just get their butts kicked bad and they end up in the hospital. So for those people, taking a 10-foot walk or sitting on the edge of the bed for 15 minutes is moderate exercise. So you always have to think of what is moderate for you on that particular day. And again, some kind of strengthening to your arms, your legs, and your core. So how do you know how to progress, how much to do if you're in the middle of treatment? Well, I just basically say use the 2 to 3 minute rule. And even if you're in survivorship, you want to start slow and then just gradually build up. I want exercise to be fun for you. I want it to be enjoyable for you. And when you get done, you should say, that felt pretty good. I would do that again tomorrow. Because humans are human. And if you do something that you don't really like or you didn't enjoy or that makes you sore the next day, you're not going to do it again. And this has to be something that you don't just do one time. It's something that you really need to be involved in lifelong. All right. So again, what kind of and this is Jose, it doesn't matter. Your heart and lungs don't know what you're doing. Are you exercising inside? Are you exercising outside? Are you walking? Are you dancing? What are you doing? Are you skating? It doesn't matter. You're doing something to continually move your heart for anywhere up to 20 to 30 minutes ideally. But if you can do 5 minutes, do 5 minutes. And then strengthening stuff. Again, weight training, if you're male or female after breast cancer, after lymph node removal is not only safe for you, it is good for you. How much do you start using? Pick up a weight or put a pin in a machine. If you can't do 10 reps in a row, too heavy. Right? So cut back a little bit. And if you're on the flip side of the scale, if you put a pin in a machine or you grab a weight and you're ripping off 30 repetitions and you're like, that was easy, then it's probably not enough. You want to find something that you can at least do 10 reps, but you can't maybe do 30 in a row. And that amount is a good challenge for you. And that 10 to 30 rule is going to last your entire life, because if you either get stronger, you're going to need to go up with your weights. If you take time off, or you've had an injury, or you've had treatment or something, when you go back to weightlifting, you're probably not going to be able to do what you did before right away. So just that's how you're going to know. If you can't do 10 reps in a row, probably a little bit too heavy, but you just keep progressing and you will get back there. All right. This is my post. This is a young woman with leukemia who's getting chemotherapy as we speak. She actually is my poster child for no matter how low your counts go, exercise is safe. So if you still are in treatment or you're living with metastatic cancer, even in the presence of a low white count, low platelets, or a low red count, exercise is safe. Now, you need to probably modify what you do. And again, you can have your physician, nurse, and physical therapist help you with that. But even in the presence of low counts, it's okay to keep moving. It's okay to exercise. It's actually good for you. But we just want to protect you either from infection or falling or bleeding. So again, just make sure that you keep moving with help from your medical team. All right. So again, regardless of your gender, regardless of what kind of cancer you have, if you're in chemo and you're bald, we want you bald, smiling, and sweating, because that is going to not only make you healthier, it actually has been shown to help your treatment work better, and it's also been shown to help you live longer and survive better. So it's just, there's absolutely no reason why we can't get our people with cancer exercising. And if you need help, it's not easy. Please reach out to your medical team. All right, so let's talk about survivorship. All right, so that is the time when treatments are done. Now, you may still be on tamoxifen or Herceptin or something, but survivorship is really basically when surgery, chemotherapy, and radiation are over. But I've been doing this for 30 years, and I've spent my life with people who've been through cancer treatment. And when it's over, it's not necessarily really over. And if you are in survivorship, you may know exactly what I'm talking about. Just because you're done doesn't mean your side effects go away. What your physical therapist will do in survivorship is we want you to keep exercising. So we're going to support you whenever how that happens. The weather changes, you change, your location changes, your access changes. We want to help you find ways to continue to exercise, because again, we know that it decreases lymphedema risk, it reduces recurrence risk, it reduces heart attack risk, which is what kills most men. And women, actually. So we don't want you to survive cancer and die of a heart attack. That would suck. So again, finding ways to keep you moving. Bone density, body mass index, those all become issues, especially for guys on hormone therapies. And then if you are living with neuropathy, again, that's the numbness and tingling in your hands and feet from chemotherapy. Exercises, well, we'll get to that slide in just a second. So let's talk about hormone treatment. Again, changes in your body composition. You're going to feel like your muscles are gone, and you just feel flabby and fat. Changes in bone density, changes in mood. That's very common, and they are very tough to deal with. So exercise has been shown in research studies to help. Does it make it completely go away? In some cases, yes, but not always. But anything to make it better is going to make you healthier and happier, more functional. And again, here's that slide I was telling you about. So chemotherapy-induced peripheral neuropathy, or CIPN. Again, that's the numbness and tingling in your hands and feet. I also called CIPN crappy, irritating pins and needles is another acronym for CIPN. But what we want you to do is, again, exercise. If you have neuropathy, it's not going to magically make your symptoms go away. You're still going to be living with that burning and pain sensation. However, if you after a while, if you stop moving, if you stop doing, you will start to lose function. You might start to get tight. You might start to have balance problems. You might start to get weak. And that we certainly don't want. So the exercise will improve your balance. It'll improve your walking. It'll improve your strength, your safety, and your function. It'll decrease your fall risk. So what I tell patients is, I wish I could take your neuropathy pain away. I really do. But it's better to be strong and have neuropathy than it is to be weak and have neuropathy. So I'd rather you be numb and tingly out in the park and having fun with your family and your friends and doing the stuff that you love versus having the same amount of numbness and tingling and being stuck on the damn couch. All right. So we do want you out and moving. All right. So the wrap up slide here again is I really want to hit home that after cancer, you deserve and should expect to return to full strength, comfort, mobility, and function after cancer. And I think that just people just kind of assume that I have had cancer, so therefore I should feel crappy the rest of my life. And that is not accurate. And we want to dispel that myth. Even if we can't get you to 100%, if we can get you to 95, 90%, 98%, that's going to be a heck of a lot better. All right. So thank you so much again for the invitation to speak here again, Sherry. And we have a few more minutes to answer any questions that anybody may have.
Absolutely. Thank you. That was wonderful. I do have a couple questions for you. Well, it says great talk.
Thank you.
My question is regarding management of cording and shoulder joint stiffness post-axillary surgery,
Yep.
in addition to massage the area to break scarring tissue. I have noticed this especially with fit, thin patients. Would you consider advising our patients to start in physiotherapy exercises prior to surgery?
Unfortunately, there is no evidence that starting any kind of range of motion or physical therapy prior to breast surgery or axillary surgery reduces any postoperative risk. It just doesn't. Now, can we get people on a walking program so they're generally healthier? Yes. Now, that is not the case for people that have had neck surgeries or radiation, lung cancer surgeries. We do see people preoperative, but there really is no way to decrease cording risk, lymphedema risk, or even postoperative tightness risk preoperatively. I mean, if somebody comes in with a rotator cuff, torn rotator cuff or adhesive capsulitis in that shoulder, certainly we can do, especially if we know already they're going to have postoperative radiation, we might get them in preoperatively, but unfortunately we can't prevent or minimize risk of postoperative issues with preoperative physical therapy.
Okay, that's good to know. And there's another one here. How can exercise reduce the risk of recurrence? I know you mentioned something about this. And what types of movements are safest and most effective for male survivors?
So we are not absolutely completely sure why exercise impacts recurrence risk. It's being studied profusely. We know that it does. It's very clear. So there's a bunch of different mechanisms. Is it immune therapy? Is it its effects on the body of our organs? Is it effect on our blood system, our brain system? And the way we metabolize insulin, or is it cytokines? We're looking at all of that, all right? But the important is it doesn't matter why that works right now, just we know that it does. So what type? My first answer is going to be whatever type that you like to do, because you got to just keep doing it. We do know that, again, that benchmark that we talked about, the 150 minutes a week. So the target is between 150 to 300 minutes a week. So the more you do get bonus points. So if you do 200 minutes a week, it is better than 150. 150 is better than 50. But again, 50 is better than nothing. So anything is better than nothing. So time matters. Intensity also matters. So we do know from studies that if you can eventually push yourself into a range that's moderate to vigorous. So moderate is you and I can hold a conversation, but you might have to take an extra breath every once in a while. Maybe we're taking a medium pace walk. That might be moderate. Where if we get you into a vigorous range where you're kind of really sucking wind, that actually gets you some bonus points. So if you can exercise, and again, I don't care what you do, whether it's bicycling, walking, running, jogging, swimming, dancing, it doesn't matter. Just move your heart and your lungs. But again, the amount of time matters, and the intensity matters. So you're certainly not going to be able to do a half an hour of continual vigorous exercise, but in those zones, maybe like walk a block, jog a block, walk a block, jog a block. So just something to kind of rev up your heart rate. Those are the best tools to get the most benefit out of your risk reduction and to help you survive best and feel best as a cancer survivor.
Okay, and you just answered one of the questions that just came in. Thank you for answering my intensity questions before I asked it. Yes, this is from a gentleman who recently went through his treatment and surgery and is a runner. In fact,
Yep.
he's going to be running in the New York City Marathon.
Hey, cool. Congratulations. I love
Yeah,
that.
I
I'll watch
know.
you on TV. That's incredible. Good for you. I'm impressed.
Is it safe to lift weights after breast cancer treatment? And how can survivors rebuild strength without risking injury?
All right. So the first thing I'm going to say is the absolutely is it okay to weight train after cancer, and it is good for you. All right. So that's the overlying caveat. However, if you are going into the gym and your chest is really tight, your underarm is really tight, you haven't lifted weights in a year or two, then we want to make sure that you don't. I'm more worried about you causing damage to your shoulder or to your rotator cuff than I am of causing any problem cancer related. Okay. But if you do feel that you're tight, if you do feel that you're weak, I would certainly address that. And it doesn't mean you can't start weightlifting, but I would start with, 5 pound dumbbells for your bicep, just things that are super, super easy. But if you are tight, if you do feel super weak, or your skin just feels snug, get to a physical therapist, and have them fix those problems before we get you back into fully developing, because there is no reason that you can't eventually, once your skin moves, your range of motion is good, that you can't get back to heavy weightlifting if that's what you choose to do. There's no upper limit on what you should or can lift. There's no scientific study that says, oh, once you have this surgery, you can't lift more than 50 pounds. That's hogwash. But we just want to, again, give you the good foundation that your joint moves well, that your tissues move well. So when you do re-engage in lifting weights, that your joints will be safe and healthy and happy.
Makes sense. Can physical therapy help with emotional confidence too, not just physical recovery? And how does movement support mental health after cancer?
Absolutely. You can't have if you just, it's hard to feel good when your body doesn't feel good, when everything takes extra effort, when everything seems to be tight and bothersome. That certainly is going to weigh on your mental health. So the two are just, you can't disconnect them. So I run actually a triathlon training program for cancer survivors. And we see that all the time. Mood just gets elevated. First of all, by giving you more function that you before just when you get in better condition, you can just physically do more. That makes you happier. When it hurts less to move, you feel happier. When you sleep better, that's certainly going to impact. So exercise just has so many, and just being in better physical condition, you look better, you feel stronger, you get up and down the stairs easier. That is certainly, again, if you have documented depression, or it's not going to fix those things. You certainly need to have that addressed. But even for people with depression, exercise is a great tool, because the stronger you are, the healthier your body moves. It's just going to lighten your mood extensively. So it's an incredible important part of mental health. So
Okay.
thank you for bringing that up. That's fabulous.
Yeah. And I have one last one for you.
Hmm.
What should survivors do if their doctor never mentioned rehab or lymphedema risk? How can they advocate for themselves and find qualified oncology physical therapists?
Typically people with cancer have 4 or 5 physicians. So it doesn't, a referral to physical therapy can come from anybody with a PA, an MD, a DO, or even a nurse practitioner. So it doesn't have, and it doesn't necessarily have to even be an oncology physical therapist. I mean, it depends on if you live in a rural location. You can get a referral from your primary physician, from your rad onc, from anybody, from your brother if they're a physician. And if you just have one PT in town, then go to that PT in town. That's going to be better than nothing. And you don't necessarily have to go. But if you live in a big city, may have physical therapists to pick from. So maybe talk to your surgeon and say, hey, or your community, and say, hey, is there somebody in town that does oncology physical therapy? So just ask around. But again, your referral does not have to come from a cancer physician. It does not have to come from your surgeon. So if one of your physicians is not listening to you, either talk to the cancer nurse navigator or just keep talking to different physicians until somebody finally hears you.
Yeah. Advocate for yourself. Self-advocate. We
Yep.
have to these days.
Yep.
Well, thank you very much, Dr.
My
Walke.
pleasure.
It's been wonderful. I appreciate you joining us
All
today.
right.